Between the eye and eyelid is a layer of tissue called the conjunctiva. The conjunctiva extends from the edge of your cornea to the inside of your eyelids and acts like a pocket for holding a reservoir of tears that keeps your eyes lubricated. For some people, this tissue can loosen or wrinkle with age, disrupting the normal process of keeping the eyes protected with tears. This condition is called conjunctivochalasis, or CCH for short. As the excess conjunctiva fills the pocket previously filled by tears, moisture is forced out and development of dry eye can occur. The eye can become severely irritated and red. The eyes can feel tired, and in extreme cases, vision may become impaired. CCH is a problem that affects many patients, but it is commonly overlooked. Since dry eye symptoms are usually the same, regardless of the cause, misdiagnoses may occur. Treatments for dry eye, such as artificial tears, ointments, or prescription medication, will not resolve the effects of CCH because the condition prevents the eye from holding liquid medication. If signs of CCH are visible, your doctor may recommend a procedure to correct its effects. The most effective method for treatment of CCH is through a simple, safe, and relatively painless procedure to remove the excess tissue that is forcing tears away from the eye. After an incision is made, a membrane of tissue called amniograft is applied that restores the normal smooth surface of the eye and allows proper tear distribution. The amniograft material contains natural properties that have anti-inflammatory and anti-scarring actions, making the recovery process shorter and more comfortable by actively promoting the healing process and reducing post-operative discomfort. With the new tissue in place, a reservoir of tears can form properly to keep the eye lubricated and reduce or eliminate the dry eye caused by CCH. By using amniograft in CCH surgery, physicians are able to provide their patients with a simple yet highly rewarding solution by alleviating dryness and discomfort to make vision a comfortable experience once again.